Now for renal failure, we're covering acute versus chronic. So for chronic kidney failure, also called chronic kidney disease, or just CKD, this is long-term chronic damage to the kidneys. We're talking over years and years of destruction, typically resulting in permanent damage. And acute kidney failure, also called acute kidney injury, is that sudden, short-term loss of kidney function, but if not stopped or reversed, it can lead to chronic renal failure. So a Kaplan question asks about acute kidney injury. What is the correct understanding? And the answer is sudden loss of kidney function due to loss of renal system circulation or glomerular or tubular damage. So what's really going on in the body? For pathophysiology and causes, let's cover the acute kidney failure first. In acute kidney failure, it can result from three types. We have pre-renal, that decreased blood flow to the kidney. So the memory trick we use is think of decreasing of prefusion with pre-renal. And then next is intrarenal, that damage inside the renal. Think in the renal for intrarenal. And if the cause is after the renal, that's post-renal. So just think post for past renal. Now let's dig into the specifics here. So for pre-renal, just think of that decreased perfusion for pre-renal. Oxygen-rich blood flow can't get to the kidneys. This decreased blood flow means decreased oxygen. So remember, oxygen is the money of the body. No money, no honey. No oxygen and the body goes broke and dies. Kind of like the kidney is suffocating to death.
You like that, did you? Well, click here and get access to over 1,000 fun visual videos, 300 study guide cheat sheets, and a massive quiz bank loaded with detailed rationales to test your knowledge, neatly organized in our new app. Click here to get started for free.
Now, this is typically caused by obstruction or vessel occlusion, where we have a blockage of blood flow, which blocks oxygen. Now, this is typically from an emboli or blood clot, or even a tumor that blocks perfusion into the kidneys. Another cause is from low blood pressure, that low perfusion with pre-renal. Like patients with shock, hypovolemia from that major blood loss or volume loss, resulting in dehydration, which results in decreased MAP, that mean arterial pressure. Fancy words for low blood pressure, meaning low perfusion, less than 65 MAP, or mean arterial pressure. Lastly, low cardiac output, we get low perfusion. So just think low cardiac output means low oxygen put out of the heart, resulting in low perfusion to the kidneys. Typically from when the heart can't pump correctly, which decreases blood being pumped out of the heart. So we see this with ECG dysrhythmias with those funky beats, and even clients in heart failure, which is a little bit tricky, so listen close. Even though we may have high blood pressure with heart failure clients, the big problem is low cardiac output. We get low volume of oxygen-rich blood out of the heart. This results in less perfusion and less oxygen to the kidneys. Next, we have intrarenal, that direct damage inside the kidney itself. Again, think intrarenal for inside the renal. Now, this is far more serious because it's more intense with intrarenal. Now, it's also referred to as ATN, acute tubular necrosis. So just think ATN requires immediate attention. Now, typically it's caused from infections resulting from glomerular nephritis, or even autoimmune diseases like lupus, where the body attacks itself, resulting in nephrotic syndrome, which we cover both in a separate video. But really the most tested top two causes for exams, write these down, is CT contrast dye, like with a heart cath. So just remember, contrast kills the kidneys. And even antibiotics ending in mycin, like vancomycin and gentamicin. So just think it's a sin to give a mycin, since it's so damaging to the kidneys. Lastly, untreated infections and even long-term use of NSAIDs like naproxen, ibuprofen, and even ketorolac can cause damage to the kidneys. It's kind of like overloading two delicate washing machines with thick cement. We literally clog the kidneys here with these medications, And in results, the creatinine lab value shoots up sky high. So the key number to know is creatinine over 1.3 is bad kidney. And the memory trick we use, just think of the 3 C's. Creatinine is the most critical lab value since it shows clogging of the kidneys. And last but not least, we have post-renal. Just think past the renals. There's a renal blockage after the kidneys, which basically blocks the outflow of urine, so urine can't get out of the kidney itself, causing a lot of pressure, pain, and strain on the renals. Like with clients with renal calculi, aka those kidney stones, or even a tumor, or even BPH, that benign prostatic hyperplasia. We see a big swollen prostate in our older men populations. So just think the memory trick, BPH, as a big prostate that holds back urine, and now we have an outflow problem. As far as assessment findings, these are pretty simple. So remember from our anatomy video, what are the 3 waste products that the kidneys filter? Well, remember we use our acronym HOOK, H-U-C, since the kidneys sort of kind of look like a pirate hook. H is for hydrogen ions, which are very acidic, U is for urea, and C is for creatinine.
For our full video and new quiz bank, click right up here to access your free trial. And please consider subscribing to our YouTube channel. Last but not least, a big thanks to our team of experts helping us make these great videos. All right, guys, see you next time.